A fatty liver, also known as hepatic steatosis, is a condition characterized by the accumulation of excess fat in the liver. Normally, the liver contains a small amount of fat, but when the fat content exceeds 5% to 10% of the liver's weight, it is considered a fatty liver. There are two main types of fatty liver: non-alcoholic fatty liver disease. This is the most common type, and is associated with factors such as obesity, insulin resistance, high blood sugar, high cholesterol, and high triglycerides. NAFLD is not caused by excessive alcohol consumption. Alcoholic fatty liver disease. This type of fatty liver is caused by excessive alcohol consumption. Prolonged alcohol abuse leads to fat accumulation in the liver and inflammation, which can progress to more severe conditions, such as alcoholic hepatitis or cirrhosis. Vitamin B3 has several mechanisms that contribute to its potential benefits for NAFLD lipid metabolism. Vitamin B3 aids in the breakdown and metabolism of fats in the liver. It helps reduce the accumulation of triglycerides, a type of fat, in liver cells. Insulin sensitivity. Vitamin B3 improves insulin sensitivity, which is often impaired in individuals with NAFLD. By enhancing insulin action, it can help regulate glucose and lipid metabolism in the liver. Anti-inflammatory effects. Vitamin B3 exhibits anti-inflammatory properties that can help reduce liver inflammation associated with NAFLD. It's worth noting that higher doses of niacin, above the recommended dietary allowance, may be required to achieve therapeutic effects for fatty liver. However, these higher doses should be taken under the supervision of a healthcare professional, as they can cause side effects such as flushing and liver toxicity. Alcoholic fatty liver disease. Vitamin B3 may also be beneficial in alcoholic fatty liver disease due to its potential effects on lipid metabolism and liver function. Alcohol impairs the body's ability to absorb and utilize niacin, leading to deficiency. Vitamin B3 supplementation can help replenish niacin levels and support liver health in individuals with alcoholic fatty liver disease. In addition to vitamin B3, other B vitamins, such as B12, B6, and folate, are also important for liver health and overall metabolism. B vitamins work synergistically and play roles in energy production, liver function, and the metabolism of fats and carbohydrates. Vitamin D and vitamin E both play important roles in liver health, including their potential effects on fatty liver disease. Here's an overview of the role of vitamin D and vitamin E in relation to fatty liver. Vitamin D is involved in various processes in the body, including immune function, inflammation regulation, and metabolism. While the specific mechanisms are still being studied, here are some potential roles of vitamin D in fatty liver disease. Insulin resistance. Vitamin D deficiency has been associated with insulin resistance, which is a risk factor for non-alcoholic fatty liver disease. Adequate vitamin D levels may help improve insulin sensitivity and reduce the risk of developing or progressing NAFLD. Inflammation. Vitamin D has anti-inflammatory properties that can potentially help reduce liver inflammation associated with fatty liver disease. Genetic factors. Vitamin D may influence gene expression related to lipid metabolism, potentially affecting the development and progression of fatty liver disease. It's important to note that the specific effects of vitamin D on fatty liver disease are still being researched, and more studies are needed to establish a clear cause and effect relationship. Maintaining adequate vitamin D levels through sun exposure, fortified foods, and supplementation, if recommended by a healthcare professional, is important for overall health. Vitamin E. Vitamin E is a potent antioxidant that helps protect cells, including liver cells, from oxidative damage. Its potential role in fatty liver disease includes the following: oxidative stress. Vitamin E can help reduce oxidative stress and inflammation in the liver, which are involved in the progression of fatty liver disease. Steatosis improvement. Vitamin E supplementation has shown some benefits in improving liver fat accumulation. Steatosis, in individuals with non-alcoholic steatohepatitis, NASH, a more severe form of NAFLD. It may also help reduce liver cell injury and inflammation associated with NASH.